Welcome. Welcome to our second public input session for the Healthcare Market Oversight Program. I'm Sarah Bartleman. I am going to facilitate our session for today. Let's go ahead to the next slide. So let's start with some meeting logistics. This is a public meeting, so it is being recorded. After this meeting, the recording will be uploaded to the Oregon Health Authority's website. Closed captioning is available. A transcriber is attending this meeting who will produce a written transcript after the meeting. When we get to comments, please state your name before making the comment and speak as clearly as possible to ensure an accurate transcription. And 3, please keep your microphone on mute until it is your time to speak to reduce any outside noises or background noises. Next slide. For today's agenda, we're going to provide a very quick overview of the Healthcare Market Oversight, or HCMO, program. The bulk of the time is dedicated to public input, and then we'll finish with some wrap-up and next steps. You do need to sign up in order to provide input to HCMO during today's listening session. The sign-up link is located in the chat. And you also can find the sign-up link on our website. We'll put the names of people and the order in which they've signed up when we get to that point shortly. Okay, so let's start with a brief overview of the HCMO program. Through the Healthcare Market Oversight Program, the Oregon Health Authority reviews proposed healthcare business deals to make sure they support statewide goals related to cost, equity, access, and quality. The Healthcare Market Oversight Program aims to promote transparency by publicly posting notices and reports so that communities have information about planned transactions. HCMO also aims to support statewide priorities by ensuring that healthcare deals support statewide goals related to affordable care and eliminating health inequities. HCMO also tracks deals in Oregon to monitor and study impact, evaluating how they may affect people, and producing reports on the impact of healthcare consolidation in Oregon. Next slide. For each proposed deal that is reviewable, OHA may approve with conditions, or disapprove. For deals that involve a domestic health insurer, OHA provides a recommendation to the Department of Consumer and Business Services, who make the final decision. Next slide. At a very high level, this slide summarizes the review process. Healthcare entities file notice with OHA that they're planning a reviewable transaction. HCMO reviews the transaction and potential impacts. That review includes inviting public comment, engaging experts. It's an iterative review process resulting in HCMO issuing the decision. And for transactions that are approved and approved with conditions, HCMO conducts follow-up reviews 1, 2, and 5 years after the transaction closes. Note that this process is only specific to transactions that are filed, the Notice of Material Change transaction. Transactions that request an emergency exemption have a different process. Next slide. During reviews, HCMO looks at how a proposed transaction could affect healthcare cost, quality of care, access to care, health equity, and market consolidation. Next slide. The Healthcare Market Oversight Program is guided by statute, administrative rule, and other frameworks. Today, we are seeking feedback to inform the administrative rules and the guiding principles and framework. We may hear feedback that relates to statutory and sub-regulatory guidance, some of our guiding documents and program operations. And if we hear feedback relating to statute and sub-regulatory guidance, we'll take that into account accordingly. All right, next slide. So for public input today, in order to provide public input, you will need to sign up through the link in the Zoom chat. We will post the rolling list of those who have signed up. When we call your name, please unmute and state your name, organization, or affiliation, and share your ideas for changes to our administrative rules or guiding principles or other feedback that you are providing today. Based on the number of people that have signed up, I think we can plan on a tentative 5 minutes per person today, pending the number of people who sign up. We currently have 3, maybe 4 people signed up to speak, so there may be time at the end to provide additional comment. And if more people sign up once we get going, we'll have a strict adherence to that 5-minute limit so that we can hear from as many people as possible. If you are unable to provide verbal input today, we will share some additional ways that you can still provide input to the program as part of this process. Next slide. OHA's role during our public input session today is to actively listen to public input and not respond. We are compiling the public input received and will consider all input when reviewing rules and guiding principles. The recording of the listening session will be posted to the HCMO website, and all written comment that we receive will also be posted to the HCMO website, and we're planning to post all comments that we've received this week by the end of the week. All right, I think we are ready to move to public input. So can we post the list of names and get the timer up, Melissa? All right, let's start with Tom Sinsick. Tom, are you here today?
I'm here. I need to be able to, can I be on video or no?
You can be on video.
It's still blocked.
Hold on just a second. It's video enabled.
Yeah.
Not yet. Okay.
It should be now.
There we go.
Oh, there we go. Hey, ready. Okay. Thank you, Sarah, and the people out there that work on this work. My name is Tom Sinsick. I'm a retired family nurse practitioner. Been dealing with the problems of mergers and acquisitions and control from people that aren't healthcare providers in the healthcare space for many, many years. I previously served on Iraq regarding the rules previous thing. I appreciated that opportunity, and I really appreciate the work and the importance of the HCMO work. And I will just start by saying the guiding principles are great. Now, how do you make those guiding principles a reality? I would, you said something about, well, kind of waiting to see whether the legislature had anything to add. At some point, I'd like to know if the legislature had anything to add, because then you'd say you were going to have another RAC, which is scheduled. Thank you very much. After the legislature met, so it's great that you're on track for doing that work. I would like to refer, and I can resubmit my comments from September 4th of 2024, and most of them pretty stand. The administrative rules need much revision, and in every step they need to be checked to make sure they're within the guiding principles that are there. And so that's basically, and I can submit them again if that's what's indicated. And but I'm looking forward to the work that you're going to do to get these administrative rules right. We know they're adopted at a time where you didn't expect the long volume of work that you were supposed to do. We hope the legislature is providing you the support you need to do this important work. I want to just give one potential example of in this state that is going on. As you know, the damage of United Healthcare to closures of OBGYN and ERs down in Eugene area since they took over the Oregon Clinic, not the Oregon Clinic, whatever the clinic was in the Eugene, Lane County area. And since that, there's been a lot of problems down there. That was before, they were granted that before HCMO existed. And so I think you're on track for doing really good work, and want to just encourage you in that area. I want to give a quick story about United Healthcare possibility here of something I'm dealing with particularly. You have a person that's insured by United Healthcare. Then you have, let's say, a nurse rehab center or a a recovery center or something like that owned by United Healthcare. And that the only insurance they might take is United Healthcare, or the only place you can go is to one of their clinics. These are problems. Yeah, I think you're very well aware of them. They're looking over so much stuff. And again, I'm hoping the legislature gives you the support you need to do this work. Thank you.
Thanks for your comments, Tom. Okay, next up is Sierra Canfield.
Can you hear me?
Yes.
Thank you. Oregon's healthcare market oversight program is not achieving its intended objectives, and it has had a chilling effect on innovation and strategic partnerships meant to serve Oregon communities and support access to care. HCMO creates a barrier for hospitals and their partners that want to maintain access or grow. It is an unnecessarily expensive process, and the Oregon Health Authority's timeline for review is long and unpredictable, creating prolonged uncertainty for patients, healthcare workers, and communities. The process doesn't reflect modern pressures that are rapidly straining the healthcare system. Changes should be made to align the rules with other mergers and acquisitions review practices and to improve the HCMO administrative rules. The administrative rules are rife with arbitrary standards that are not based in statute and that create practical challenges. In addition, HCMO has insufficient procedural safeguards to ensure that the reviews are objective and fair. We encourage OHA to simplify the process and this program and create objective, clear standards for those under its enforcement authority. The administrative rules include ambiguous and arbitrary terms that are not part of the underlying statute. For example, OHA created the term form of ownership, even though statute doesn't include this term, nor does it give OHA the authority to review a transaction solely based on the identity of the purchaser. OHA also created out-of-state criteria, which include arbitrary standards that create practical challenges and waste. I realized I forgot to introduce myself at the start. My name is Sierra Canfield with the Hospital Association of Oregon, and the Hospital Association has significant concerns with OHA's lack of transparency, use of outside advisors, and failure to comply with the 180-day timeline. HCMO passes through the costs of its outside advisors, such as actuaries, accountants, consultants, and legal counsel, to the parties to the transaction, such as a hospital. OHA has no incentive to limit the costs passed through to the parties. The cost of OHA's outside advisors is an extraordinary burden to the parties to the transaction. OHA should establish processes to bring transparency and oversight to the fees charged by outside advisors, including the ability for parties to audit or challenge an invoice. The automatic and unilateral tolling by OHA of the 180-day review period for each information request is a problem. The HCMO authorizing statute is clear. OHA shall complete the comprehensive review no later than 180 days after receipt of the notice unless the parties to the transaction agree to an extension of time. This is ORS 415-501, Section 7. Nothing in OHA's authorizing statute gives OHA the authority to unilaterally extend this 180-day review period. Yet this is what OHA is doing, with major consequences to the healthcare system. Workers, patients, and employers must navigate the uncertainty that is created by these delays for far too long. The HCMO program is diverting dollars that could be spent on patient care to compliance with this program and creating a barrier to transactions that would benefit Oregon communities. The Hospital Association will submit more detailed written comments as well. Thank you.
Thank you. All right, next up is Larry Kirsch. Larry, I don't know if we see your name on the participants. Are you one of the phone numbers? If you can message one of the hosts and let us know if you're here, we can unmute you. All right, I'm not seeing that Larry is here. And I don't think that we have Kelsey either. Kelsey, if Wolf Cool, if you are here and want to provide verbal comment, and are one of the phone numbers, please also message us and let us know so we can unmute you. All right, reminder that you can sign up to provide public input during this session. The link is in the chat. It is also on our website. The listening session will remain open. We will stay on the line and continue to check in to see if folks are signing up or if anyone is here to provide feedback during this hour. Tom, I see your hand. Can we unmute Tom again, please?
Yeah, just quick. I wanted to give that for a summary, but thank you for this additional opportunity. I'll just make it as short as I need to. I wanted to remind everybody that we're on this and HCMO that Oregon is unique in that we have a constitutional right to healthcare, affordable healthcare. And these mergers and acquisitions have only been driving up costs. And so having a strong guard on that while we get to our universal health plan in Oregon, which is a pathway forward, maybe that would be something that would be a reminder add-on to the principles, that we have a core principle in our Constitution that should be there. So that's my comment right now. Thank you.
Thank you, Tom. At this time, we do not have anyone else signed up to provide public input, so we will stay on the line and see if we receive any signups. The public listening session is still in progress. The listening session is still in progress. We have about 30 minutes remaining for verbal input. If you would like to provide feedback for the HCMO program during this meeting, please sign up using the link located in the Zoom chat. The listening session is still in progress. We have about 15 minutes remaining for verbal input. If you'd like to provide feedback for the HCMO program during this time, please sign up using the link in the chat. We have about 5 minutes remaining for the input for in the time for public input in this listening session. This is your last call. If you would like to provide input today, please sign up in the link in the chat, and we have about 5 minutes before we wrap up. All right. Thank you, everyone, for attending this public input session. We're going to go ahead and wrap up and share some next steps. So this slide shows the tentative timeline for our next steps in the reviewing the guiding principles and the rulemaking process. This was our second of 2 public input sessions. There is a policy board meeting at the end of the month on September 30th to review and hopefully approve the guiding principles and any changes to the guiding principles. October 10th is the deadline to apply to be on the Rules Advisory Committee. Rules Advisory Committee meetings will be scheduled for November, and the rules process will continue from there. All of these dates are tentative and subject to change, but the policy board meeting is on the calendar and the deadline for RAC applications is October 10th. Next slide. You are welcome to submit feedback to inform HCMO's rulemaking and guiding principles at any time. Anyone can provide feedback to inform this process. You can submit that feedback via email, our public comment form on the website, or leaving a voicemail. All comments will be posted to the HCMO website. Next slide. Again, apply to be a RAC member if you would like to continue to participate in this process. The deadline is Friday, October 10th. Next slide. And more information about the rulemaking process, public comments that we've received to date, and all the rest is on our website, oregon.gov/HCMO. Thank you everyone for attending and participating today, and we will end there.